So can you share your screen, sir?
Sure. Okay. Hey guys, so welcome again to this another session of embryology. And in this session, we are going to continue from where we left in the previous session and discuss all the other aspects of embryology, how the different systems, different body parts are being formed. So I'm Dr. Ankit, your anatomy faculty in Auricle, and let's start this session. In this session, we are going to discuss other also development features over here. You can use this code Dr. Ankit 20 for discounts on subscriptions. And these sessions are not only useful for the university exams, which they are obviously in a much bigger way, but also for the other MCQ exams like next or NEET PG. So these are sort of questions that can be coming, that can come from the topics which we are going to discuss. I advise you to take a screenshot of this and do refer to it later on how to write. Why Oracle particularly? So yeah, from features like recorded live classes, we have exam modules, we have Q banks, we have doubt clearing sessions, we have practical classes also. Let me just give you a brief idea. Recorded, we all must be knowing. Live, we all know about what is live session. Exam modules, we have doubt clearing sessions, a very important and good initiative. Beautifully crafted notes, I must tell. And Q bank are obviously much needed. Q bank. Basically, they test what you learn and practical sessions again, uh, much important for a professional course like this. And finally, we have some plans over here: foundation plan for 3 months, advanced learning plan for 6 months, complete learning plan for 12 months, and final ultimate MBBS plan for 4 years. And you can use all these features over here. And as you see that in this in these complete learning plan and ultimate MBBS plan, these last two plans over here, in these two you get hard copy notes set as well as your doubt clearing sessions also, and these are also for an extended period of time, 1 year and 4 years. And for other discounts, you can use the code for other discounts on any of the subscriptions which you might like. And I urge all of you to download the Auricle app also if you have not done it by now and look at it, the features of it. The latest medical news are also being uploaded on it time to time, and all the features are there. Fair enough. Now let's continue to the topic from where we left in the previous session. So guys, this was a topic, and if you recall, then we were discussing the amnion, colon, and the general embryology. Now we are coming to the basically the different parts of the body, how they are formed directly. As I told in the previous session, also in the end, that the main part of the embryology is being done for the understanding part. Now, basically, we have to see that how in the fetal period, remember from after 8 weeks, that after 2 months, how in the fetal period the different parts of the body are formed, how much of ecto, meso, endo are contributing to the different parts, and slowly realize it with the adult human anatomy and correlate the embryology with the adult human anatomy. He will understand it better. Development of diaphragm to begin with. Now, development of diaphragm, there are many things, and let me put a star mark on these topics to let you know how important are they. Development of diaphragm. So I will use supposedly from 1 star to say 5 stars. So 1 to 5 stars will be there to just let you know both on the university exam perspective and your MCQ exam, how important are they. So obviously the diaphragm over here, 4 stars are enough for this. For a few years back, 5 stars, but now 4 stars. A lot of live questions have come. Diaphragm we are discussing over here is basically the thoracoabdominal diaphragm, which is diaphragm, the thoracoabdominal diaphragm. Two, three things understand before discussing what are the different parts which give rise to it, because that is whole data over here. But what you have to understand, what my job over here is to give you some concept behind it. In the beginning, the diaphragm is started to develop in the region of neck of the embryo. And it is this reason that if you look at the nerve supply of the diaphragm, it is coming from C3, C4, C5 nerve. And the nerve which supplies the diaphragm, basically we are dealing with the motor nerve which supplies the diaphragm, is your name is a phrenic nerve. PHRENIC, phrenic nerve. Okay. Root value is C3, C4, C5. This is the reason. Because now in an adult body, we see the diaphragm is lower down below the lungs. And somehow you feel that why this nerve is coming from here and supplying it. It is at risk. The reason is it is begin from here. Then you might ask, then why, sir, it went down? It didn't went down on its own. The thing is that Initially it was over here, then slowly the heart and the lungs developed, and then they pushed it down. Then they pushed the whole diaphragm down. This is the whole point. Now, diaphragm is basically formed by four different parts. Four different parts are going to form the diaphragm. And basically, in embryology or anatomy, look at the diagrams. It gives you a very good perspective. If you look over here, the four different parts, let me show you over here. This is the posterior aspect, this is the anterior aspect. Look at this image. That is part number one, septum transversum. What is septum transversum? Now, see, there will be many terminologies which will come and they might try to dominate over you. Okay, what is septum transversum? Just by reading this word for the first time, you will be like, oh my God, this must be something very complicated. But no. In medical science, one thing is that the words might look complicated, but they are not. Okay, because you don't have to derive any formula over here, like you used to in your physics and all if you remember in your 12th, right? So septum transversum is actually the thing because it is like a transversely lying septum, but where it is coming, it is basically a part of the mesoderm. It is actually a part of the lateral plate mesoderm. Remember this. So one is septum transversum. The other part over here is this pleuroperitoneal membrane. Now, so you might again think that are very complicated name, not complicated. Pleura is what? Covering of lungs. Peritoneum is covering of the gut part, abdomen. Where is diaphragm? Between the pleura and the peritoneum, pleuroperitoneal membrane. So diaphragm above pleura, below peritoneum. Pleuroperitoneal membrane will form diaphragm. Fine. So number two is this. Number three is the mesentery of the esophagus over here, because you can see the esophagus lying over here, So there's a surrounding mesentery, or you can say the dorsal mesentery of esophagus. This is number three, third component of the development of diaphragm. And the fourth component is lying on the periphery, that is from the muscle part of the body wall coming from somites. This is basically the somites, which is the fourth part. So basically there are four parts in development of diaphragm: septum transversum, pleuroperitoneal membrane, mesentery of esophagus, and your somites. These are the four parts. And they all combine in such a beautiful manner that there are problems, congenital problems in diaphragm, but to a very low percentage. But their development looks very complicated. It looks like there will be it will be much commoner for a development, for a congenital diaphragmatic syndromes or problems. But surprisingly, their incidence is very low. That's a good part. So remember, these four things, they contribute to the development of diaphragm. And I also told you that why is such that the nerve supply is coming from phrenic nerve. Other things you can just read it and understand. Now comes another topic: pharyngeal arches. Pharyngeal arches. Again, coming to the star mark, I hope diaphragm, how I guess we made 4 star mark, right? Right. Okay. In the pharyngeal arches, you asked me 10 years back, and after 10 years also, if I'm available over here teaching you guys, I will still give it 5 stars. This is so important. So important. If you visit your museum in your anatomy department, the most of the, if I've been to, I don't remember the number, but many medical colleges, maybe around 30-40 medical colleges, as an internal or external examiner, in the museum, when we take the embryology Bible, they all have the model of pharyngeal arches. And it is one of the most common questions in university exams as well as your MCQs. Now, let's understand this. Then the data will come. First of all, understand. Pharyngeal arches, over here, all the three components are present. Ecto, meso, endo. Okay. Here also, if you will see in pharyngeal arches, there is a major contribution from the neural crest cells. From which cells? Neural crest cells. Basically, they were part of what? They were a part of ectoderm only. The neural crest cells. Major contribution comes from here also. You can see. Now there are total of this actually pharyngeal arches is actually the development of this region, the lower part of the face and the neck region. All that this region development is in the form of arches. Now why? If you remember your biology, zoology classes in your 11th and 12th, you will remember that what I'm remembering now after so many years is that in the beginning, when there's an embryo, it looks like a embryo of a fish. So there are gills in fishes, right? For which the breathing happens, for the oxygenation happens for the fishes. Similarly, in humans also, there are gills in the beginning. Those are pharyngeal arches in the region of neck. But in humans, as the whole system is different, then obviously they will be covered and there are no gills obviously later on. but in the beginning there are these gaps. These are known as pharyngeal arches. So you can take the whole history from there. How did it actually started? Why is it so? It is actually a whole process of evaluation. If you go, and there are many books of evaluation, you do study them also some other time. So yeah, this lower part of face and neck. Now what happens is there are total 6 pharyngeal arches, but out of the 6 pharyngeal arches, the 5th arch it disappears. So finally we are left with the 5 pharyngeal arches. If we give numbering, it will be 1, 2, 3, 4, and 6. 5th arch disappears. Do remember that. Okay, I hope this must be written in the first lines. Out of the 6 arches, the 5 arches, actually it is not 5, it's the 5th arch disappear. It is the 5th arch, or not. If 5 arches will disappear, only one will left. No, so it is a 5th arch which disappears. So finally we have 1, 2, 3, 4, 6. How to understand it now? If you keep your fingers like this, okay, 5 fingers we normally have. So these 5 fingers are represented 5 pharyngeal arches. So you keep both of your hand like this on the side of your neck and face. These are representing the 5 arches on both the sides. Outside is ectoderm, inside is endoderm, as I told you, that 3 concentric ball theory, and between is the mesoderm part. Simple as that. So these arches are having all these ecto, meso, and endo parts. And they represent the lower part of face, which will include a part of ear also, as well as this region of the neck. They include the development of tongue also. This, do remember it. Okay, so let's see then. Pharyngeal apparatus develops from the late lobe of pharynx in the 4 to 5 weeks. Derivatives. Now derivatives are asked. Now there are few things which are easily or frequently asked in pharyngeal arches. Let us just give it some time over here for you to understand. So total are 5 pharyngeal arches. Okay. Now, if you take a section like this, now which section will be this? Suppose I cut it like this, transverse section. I cut it like this, sagittal section. If I make a cut like this will be which section? That will be the coronal section. So if I take a coronal section of the pharyngeal arches, then on the outside there are ectoderm, right? So we have 5 arches. So first arch, second arch, third arch, fourth arch, and sixth arch. Okay, on both the sides, if I can make over here 1, 2, 3, 4, and 6 outside. This is the ectoderm area. On the inside is the endoderm area. On the inside is the endoderm area. So let us make that also. This is first, second, third, fourth, and sixth. This is first, second, third, fourth, and sixth. So try to understand, this is ectoderm, this is endoderm. Okay, and in between this is the mesoderm area. It can be also called as mesenchyme. We can call it as, or mesoderm. Now this entire thing over here, this becomes one arch, which includes ecto, meso, and endo. All this is one arch, first arch. This is second arch, and likewise third, fourth, and sixth. Now there are a few things over here which we need to understand. What are that? That in between these arches, suppose this is labeled first arch, second, third, fourth, and sixth. In between them over here, this is what? This is your area between 2 arches. So that is known as pharyngeal membrane. There are now few terminologies. This whole area. Okay. The infolding, the infold, or not the infold, the outgrowth of the endoderm is known as pharyngeal pouch. So only endoderm, if there is outgrowth, that is known as pouch. The ingrowth of the ectoderm is known as cleft. So this will be known as ectodermal cleft. You can call it as ectodermal cleft also. And that can be known as endodermal pouch also, pharyngeal pouch or endodermal pouch. So the outgrowth of the endoderm is known as pouch. The ingrowth of ectoderm is known as cleft. And when all of them, they try to meet, what is that? That is known as your membrane. I'm telling the terminologies over here. So we have 5 arches outside ecto, meso, endo, and you have pouches from the endodermal side. So the endodermal side, again, I'm writing, give rise to pouches. The ectoderm side gives rise to what is known as cleft. Now, each arch, few things will be asked to you, which is actually a data-driven thing. Let me tell you over here. Each arch, they will ask you what is the nerve supply, which nerve lies in each arch. Question. Which artery will lie in each arch? Next question. Okay. What will be the skeletal derivatives of each arch? Okay, what will the muscles of each arch? Now, why are there so much of importance over here? Because again, everything is related to the output. If all this knowledge has no implication in your future medical career, then there is no use of the knowledge. Let me be clear over here. It is as simple as that. Understand the dynamics of the world. Why so much is taught to you on any particular topic? Because more of the clinical cases come from that particular topic. Therefore, pharyngeal arch syndromes, non-development of any particular arches, they give rise to a lot of syndromes. Right from teacher calling syndrome, different. There are a lot of syndromes. So therefore, this is taught in detail. So each arch will you have to understand what are the nerves, artery, skeletal, and muscle derivatives, stuff like this. Okay, that is one thing. So nerve, let me tell you over here in the beginning only that suppose I write over here the number of the arch, and let us only tell you of the nerve in the beginning. So arches, first arch, second arch, third arch, fourth arch, sixth arch. First arch nerve is mandibular nerve. Second arch nerve is seventh or the facial nerve. Third arch nerve is glossopharyngeal or the ninth cranial nerve. Because cranial nerves only will come over here, no? Fourth arch nerve is superior laryngeal nerve branch of vagus. And sixth arch nerve is recurrent laryngeal nerve branch of vagus. You know the arches, the nerve of each arch. And whatever muscle they supply each nerve, that will become the muscular derivative. Similarly, which area skeletal derivative and artery will come there. Don't worry, that is all data driven, but understand the arches anatomy first of all. Right? So we just touched on the nerve part. Then see, if you look at an adult human body, then you don't see any different structures over here. What actually happens is that if you look at the side of the face and the neck, the only structure that you are seeing, if I just tilt to one this side, the camera is over here. If you look at the side of my face and the neck, not face, but this area, okay? The only structure that you are seeing is this pinna and the external auditory canal. That's it. That's it. Now what happens? So look at the diagram over here. If I enlarge the, not enlarge in this diagram only, we can try to explain. Let's just change the color over here. Now see this, you can see the first and second arch, their ectoderm. Now this ectoderm over here and over here, they will combine and they will form what is the pinna over here. Pinna. Okay. And can you understand what was this? This was the first ectodermal cleft. You can see the ectodermal cleft. This is the one that is going to go inside, and this first ectodermal cleft is going to form the external auditory meatus. I hope you got the point. The only major structure that you're seeing over here is the pinna, and that's it. Rest everything is smooth over here, simple skin and bone and simple muscles inside. But outside this ectoderm, there's only one development, is this pinna and the external auditory canal. That's it. This comes from where? The hair. So first ectodermal cleft gives rise to external auditory meatus. First ectodermal cleft, it will be your simple question. And if they ask you pinna coming from pinna, you will say first and second arch. First and second ectodermal part of the pharyngeal arch, they give rise to pinna. Then understand, very important is if I use a highlighter over here with a slightly darker color, the second arch ectoderm, focus on the second arch ectoderm over here, it actually comes down and it overlaps the other arches. And therefore, you can see below the pinna, everything is smooth because now all of that is overlapped. All of that is overlapped. Now, why I'm showing you over here? Because a very common congenital anomaly that is seen later also are the development of some sinuses over here. So let me try to use a different colors. Suppose this overlap of the second ectoderm below is incomplete. So there will be few sinuses here and there inside. They are known as branchial or pharyngeal sinuses. There will be swelling over here in front of this muscle, sternocleidomastoid, which swelling might increase in the later life, that not later, that much later, but 10, 15, 20, 25 years of age. Not in the beginning, but later the swelling might increase. So that is known as branchial sinuses, which is very common. Its location is very important. Location, as I said, just in front of sternocleidomastoid. Let me write over here. front of sternocleidomastoid. Are you understanding why this topic is becoming more and more important? Because of more clinical implications. The most common I'm telling you just to incite the interest in you guys so that you understand this and you read it more and understand this from the outside. Okay, so from the outside you will see only one development over here, but on the inside where we had all these pouches, there are different structures that are going to develop. Now if I ask you and you answer yourself, how many pouches are there in the 5 arches? How many pouches are there? Count them: 1, 2, 3, 4. 4 or 5? Only 4. So we have the first pouch over here. Let me just number them. This is the first pouch. That is the second pouch. That is the third pouch. That is the fourth pouch. Simple. You have 5 fingers now. How many interdigital cleft? We have 4 cleft. 1, 2, 3, and 4. That's it. So we have 4 pouches. And these 4 pouches, they give rise to different structures, but on the inside. That is not relevant, or that is not appreciated outside. Well, it is inside. So that comes as a question, okay, that what are the derivatives of pharyngeal pouches? That is also one of the most frequent questions that is asked. So pouches, we have first pouch, we have second pouch, we have third pouch, we have fourth. So do remember this. Okay, let us see what are the derivatives, main derivatives of it. See, first pouch. If you remember the first pouch, this was the first cleft, right? First cleft was this between first and second arch, first cleft. What is just inside the exonoidary canal? What is inside? We have the whole middle ear. Yes, the middle ear is coming from the, I hope you got my point, what I'm trying to tell you. So this is, say, the pinna, that is the exonoidary meatus. This is tympanic membrane. Which structure is over here? This is middle ear. And along with it, what passes? The eustachian tube. The middle ear and eustachian tube, they are coming from first pouch. Why? Because this outside was first cleft. So this is from the inside, you have this first pouch. Got the point? First pouch, first cleft. This is so simple to understand. The second pouch over here gives rise to palatine tonsil, or the tonsillar fossa, I can say palatine tonsil. Understand this? On the inside oral cavity. The third pouch, how do we write it? We write as THIRD, third pouch. Why I'm writing third? Because it will help you in remembering. TH is for the thymus, and I is for the inferior parathyroid gland. Inferior parathyroid gland. And fourth pouch gives rise to the superior parathyroid gland. Superior parathyroid gland. Along with it, what happens is, as I told in the beginning, that there's a lot of contribution from the neural crest cells. So in the fourth pouch, the neural crest cells will come and they form a particular group of cells that is given a very different or special name known as ultimobranchial body. Known as ultimobranchial. Don't worry with the name, guys. Just read it for 2-3 times. It will come into your reflex. Don't worry too much of the names. Just read it for 2-3 times. Ultimobranchial, something related to the branchial arches. So pharyngeal arches are also known as branchial arches. And this ultimobranchial body, it gives rise to parafollicular C cells of thyroid. It gives rise to what? Parafollicular C cells of thyroid. So this parafollicular C cells of thyroid is all coming from fourth pouch. This is coming from third pouch. That is second, and this is first pouch. 4 pouches were there. At least remember this much. This much is sufficient. Now let us come to the notes and see what extra we can gain from the notes. So derivatives of pharyngeal arches are being shown over here. First arch, nerve, I told you, nerve they ask, artery they ask, skeletal structure they ask, and the muscles. So all these muscles, that will also give you a hint. What hint, sir? Hint is C. That will do in detail in head and neck. That this nerve, mandibular branch of fifth nerve, supplies all these muscles. Then second arch, which nerve was there? Facial nerve. So these muscles are supplied by facial nerve. Artery and skeletal structure are also there. Third arch, here we have a slight correction. It is the ninth nerve, not the greater petrosal nerve. Greater petrosal is actually a branch of seventh nerve, right? So it is, remember, ninth nerve only. Which is the name of ninth nerve? Glossopharyngeal nerve. Okay, glossopharyngeal nerve. And fourth arch, we have superior laryngeal branch of vagus. And sixth arch, we have recurrent laryngeal, again a branch of vagus, 10th nerve. So which are the nerves of pharyngeal arches? 5, 7, 9, and 10. Along with 10 accessory also run 5, 7, 9. So these are the 4, 5 cranial nerves which are supplying the bronchial or the pharyngeal arches. Simple as that. Okay, let us go more. See, I told you syndrome. So many syndromes are there. I didn't mention the name, but yeah, there's a dijaw syndrome where third and fourth pouch is having some issues. Other issues are there. Okay. Now come to the another part. You guys, pharyngeal arches topic was very, very important. Let me tell you that. Now coming to the development of face. Coming to star marks again, not more than 3 stars I will give. But again, I'm not sure. But if you go to pediatrics department, or gynae department or pediatrics or not particularly pediatrics, go to surgery department, mainly pediatric surgery. Which department, if you go to, if you have this privilege, if you have pediatric surgery department in your college or hospital, do visit it whenever you are free or you happen to go there. There you'll see a cleft lip and cleft palate patients. Small people, small children, cleft lip and cleft palate patients. These are due to the abnormalities in development of face. Simple as that. So we should know, okay, which part of the face coming from which particular process, so that we understand what is this whole child that is having, what issue is happening over there. So face development, we have few processes. In beginning over here, we have this frontal wound, so frontonasal process, which gives rise to your what we say the nasal process, medial and lateral nasal process. Then we have maxillary process and mandibular process. These are 4 or 5 processes that give rise to the whole structure. So we have a frontonasal process as written over here, which gives rise to your nasal processes, which we have both medial and lateral nasal process. More medially medial, more to the side lateral nasal process. Maxilla bone, maxillary and mandibular process. So these 3, 4 processes, they give rise to the development of face, as simple as that. Okay, let us see over the weeks also written over here. What happens in week 6, beautifully written so that you understand. Best understood with the help of the diagrams like these, that you understand it. Okay. So here we are seeing the lateral nasal process, and this is the midline intermaxillary segment that gives rise to the medial nasal process over here. Right, then we have this green color mandibular process, and this between the lateral nasal and this green, we have this blue color that will be the maxillary process over here. I will show you a better diagram over here. Then we'll see what are the different derivatives of it. Here is a diagram. Look at this diagram. This is probably taken up from Langman's, I suppose. Yeah, it is from Langman's. Look at the time period also. 5 weeks, 6 weeks, 8 weeks, and 10 weeks. Suppose you tomorrow you do a radiology, then also you should know. You're doing gynae, then also you should know. Okay. So color coding over here, try to understand the color coding. The yellow color is determining the medial nasal process. So let me help you guys over here. Yellow color I'm showing with this color, right? It is showing the medial nasal process. Okay, then is the blue color. Blue color showing what? The lateral nasal process. Look at this image, final image also. The blue color is showing the lateral nasal process. Red color is showing the maxillary process. Red color is showing the maxillary process. And colorless, or which color to denote it? Let me show you with this purple color. The lower one, this I'm showing with purple color. Okay. This purple color over here, that is a mandibular process. Mandibular process. Okay, purple color over here. Now look at this image on the 10th week. 10th week, that is your which month? Third month over here. And you will see, okay, that medial nasal process, yellow color, is forming what? The crest of the nose. Look at the camera, look at my face. This finger which I'm moving over onto my face will give you the areas coming from the different processes. Keep it very simple. Okay. Medial nasal process, the crest of the nose, the tip of the nose, the columella, the philtrum, and the medial part of upper lip. I repeat again, the crest of the nose, what I'm telling is that part of the face coming from medial nasal process. Crest of the nose, tip of the nose, columella, philtrum, and goes down to the medial part of upper lip. If you extend it forward, not onto the face, but inside, it gives rise to the primary palate and the upper 4 incisor as well. But on the face, you can understand. Okay, so this is your medial nasal process. This is your medial nasal process. Now look at the lateral nasal process, the blue color in this image, last image over here. The sides, this ala part of the nose, this part of the nose, only that part is coming from the lateral nasal process. Now come to the red color maxillary process, obviously the cheek area, maxillary process. But it also goes down and it forms the lateral part of the upper lip. Okay, so lateral part of the upper lip, maxillary process. Medial part of the upper lip, medial nasal process. So if I write over here, U dot lip, upper lip. Okay, laterally it is your, what it is, imagine the red color maxillary process. And then let me show with this color, this is the medial nasal process. This is the upper lip development. Finally, mandibular process, very simple. Mandibular process only from the lower lip and the jaw, mandible part. That is the mandibular process. We should, this is a must know thing. Now, what happens is, the problem is that various these processes, they fuse and they form a beautifully looking face. Every human face is beautiful. But if these processes do not fuse, then there occurs a cleft over here, some gap over here, which does not look that pleasing. But we're not discussing how do people look and not look. But the problem lies that once the child, the newborn child, basically what is a newborn child feeding upon? The mother's milk, the sucking power. If the whole cleft, there's a cleft in the lip, cleft in the palate, then he is not able to suck the milk from the mother's breast. And that is fatal for the life of the child. Are you understanding the relation? It is not just for the cosmetic reason we are discussing over here, but for the survival of the whole child over here is at stake. Okay, this is the whole point. So this is the, remember, the development of the face, and these are all the regions given. Let us go through. The frontonasal is actually your both the nasal process. They go rise to the nose, nasal cavity, septum, and all, or filter on upper lip. Maxillary, as I told, lateral part of the upper lip and cheek area. Mandibular process is chin, lower lip, lower part of cheek, and all that. That comes under the mandibular process. And these are your olfactory part. Fine. Okay. Now development of various parts of face. Just go through them. But I told you to mainly understand, because clinically or in Vivavos or MCQs, questions mainly come from the cleft lip. Because again, as I said, if you by chance happen to go to a pediatric surgery department, you might see, if not on once, but actually for second or third time, fourth time, you might see cases of cleft lip and cleft palate. So cleft lip is quite common, and it is divided into unilateral cleft, one side cleft upper lip. So cleft upper lip is very, very common. Then there can be bilateral cleft upper lip. Now, if the question come in MCQs like this, let me frame the question for you. They might give you a theory question, or they might give you a face of a child having cleft upper lip. Okay, suppose there is a one side, suppose imagine the left side, there's a cleft in the upper lip, cleft. And they will ask you, okay, which processes did not fuse such that this sort of face is being formed. They won't say it is a cleft upper lip, whatever. They will give you an image and they will ask you, it is due to the non-fusion of which processes. So if there is a unilateral cleft upper lip, you know it is a non-fusion of medial nasal and maxillary process. So cleft upper lip, basically one side, it is due to medial nasal and maxillary process. Do remember this. One of the most famous questions. Here they might confuse you with options like lateral nasal and medial nasal, lateral nasal and maxillary process, maxillary and mandibular process. So many ifs and buts over here. But you be prepared, because this is one of the most common things. Okay. Okay, development of upper lip, we have discussed. Innervation of face, fine. And let us see some questions now. Which of the following now doesn't innervate face? So that we'll learn more in our hand neck part when we will start with scalp and face. So there is ophthalmic, there is maxillary. Obviously, this is when a very easy plant is for the foot. No, philtrum is developed from this. You can answer philtrum over here, developed from medial nasal process. So medial nasal is not in the option, but frontonasal is the one, because it's the word nasal over here. It is giving rise to both the medial nasal and the lateral nasal. So you can easily go with the frontonasal process. Nasal septum, again, nasal septum lies in the midline. So even even if you don't have knowledge, guys, a lot of time in your life, the common sense is going to help you. So again, septum is the middle, so it is in the medial, not the median, it is medial nasal process, right? Medial nasal process. Okay, that will give rise to the answers like this. Now, development of tongue. Again, tongue development over here again is derived related to pharyngeal arches. related to pharyngeal arches. Then define or begin with saying this. Then let's proceed. So middle most part of the mandibular arches, see mandibular arches again. What was the first pharyngeal arch? What nerve was supplying the first pharyngeal arch? V3. So the nerve was supplying the first pharyngeal arch is mandibular nerve. Therefore, first arch is known as mandibular arch. Understand this. The nerve supplying the first pharyngeal arch was mandibular division of trigeminal. Therefore, the first arch is known as mandibular arch. So middlemost part of the mandibular arches proliferate to form the two lingual swelling. We'll show you the image. Lingual. Wherever you see the term lingual, okay, it is related to tongue. Understand this. Lingual means tongue. We will see things like lingual nerve, then lingual artery, lingual swelling over here. That is all related to tongue. Understand this. Lingual. Okay, lingual means to speak. So tongue is very important for speaking. So lingual swelling appear and medial swelling is known as impasse with the different names. Don't worry about them. Again, this is very important. Okay, I'll give you 2 stars or 3 stars for university exam. University exam, it is very popular question. Then for the MCQs. Okay. Initially, did I give the star for this or not? Face. I think I gave. Let me just check. I'm just, yeah, 3 stars I gave, right? But yeah, for the tongue, it is more important for university exams over here. University exam, it is more important, right? So there are these terms over here. First, let us look at the image. This is the image over here. You will understand it. First arch, second arch, third arch, fourth arch, fifth arch disappears, and sixth arch. So from the first arch, we have this lingual swellings on both the sides between your tubercle and impar. And from here, let me actually highlight this, will be much better for you. Hypobranchial eminence is there, tuberculum impar. Remember these 2-3 names. And you will definitely have a model also in your embryology museum, in your anatomy department, showing you this. So these are all the arches, and this is why if you look at the nerve supply of the tongue, it is supplied by fifth nerve also, like your trigeminal nerve part, mandibular nerve. It gives off the lingual nerve. Then you have the second arch, so it will give a branch of a facial nerve, that is a cauda tympani nerve. Then third arch, what was the nerve of the third arch? Ninth nerve, so ninth nerve. So these nerves, and behind here the 10th nerve. So now I'm not teaching you the gross anatomy of tongue, but remember all of this. If you understood the embryology, 50% gross anatomy you understood. Why? Because in the gross anatomy of tongue, there will be a very, very important part is the nerve supply of tongue. And then again, all of this will come that there's a lingual nerve. It is a branch of V3. There is cauda tympani nerve, branch of 7th. You have the 9th nerve. Then you have the, which one? Internal laryngeal nerve, branch of vagus. If you look at 5, 7, 9, 10, they are all branches of, or they are all nerve supplying pharyngeal arches. See the direct connection from embryology to gross anatomy. This is how we connect and understand the human body. And that makes the subject as one of the most interesting subjects on planet or on MBBS course. That's it, right? Now let's come to the skin part. Okay, so tongue part, at least remember this. And yeah, do remember the small word over here also. What is that? Foramen cecum. What is that doing? What is the importance of this? Let me just highlight it a bit over here. This foramen cecum, from here a duct will go down, and that is going to form dash gland, guys. This is up to you. I leave it up to you as a homework. Okay, homework. From foramen cecum, a duct will go down, and that gives rise to dash gland. Up to you. It's your homework. Find out, and learn its embryology also. Development of skin, we already discussed as the ectoderm. Ectoderm gave rise to only the epidermis, while the dermis was coming from mesoderm, if you remember. So do remember whenever someone asks you skin development, it is not entirely ectoderm, but it is also mesoderm over here, because epidermis, dermis are different. Okay. In addition to the above 2 sources, melanoblasts of the epidermis give rise to development neural crest cells. Yes. So neural crest cells, as they were coming from a part of ectoderm only, though we said that they are the casually as a fourth germ layer or regarded as, but yeah, they are a part of ectoderm only. So they do function in this manner. Okay, they give rise to the melanoblasts, the color over here. Appendage of the skin, basically hairs and nails and glands and all, they are coming basically from epidermis. at least remember this part. Then we have that whole histology of the skin. Then we'll discuss all the stratum layers, stratum base layer and all that. So don't worry about it right now. Okay, this all will come in the histology part, all the stratum layers. So don't worry, don't worry too much of them right now. The time will come for different parts for you to understand. Remember, the dermis is mesodermal. Okay, which of the following is not a layer of epidermis? Again, obviously, dermis is not a layer of epidermis. That is common sense. Because what actually happens is, for the skin, let me tell you, we have an epidermis, which we have seen, and we have a dermis. Okay, epidermis has layers like stratum, corneum, granulosum, spinosum, lucidum, all that. Then you have a dermis. Dermis actually has what? It has the reticular and the papillary layer. It holds the epidermis. Okay, below this you have a hypodermis. Why I'm telling you this, I will let you know. Hypodermis is nothing but it is actually a part of superficial fascia. Now see, if can you correlate it? Epidermis, hypodermis. Can you correlate it? We did in the general embryology. Epiblast, hypoblast. Epi means above, hypo means below. So if you can correlate epiblast and hypoblast from your general embryology lecture and apply it over here. Okay, hypodermis is just a superficial fascia. Okay, epidermis and dermis develops from obviously ectoderm, both A and B, right? Both A and B. Mesenchyme is derived from mesenchyme is basically your part of mesoderm only, basically. So it has paraxial mesoderm, somatic layer, and yeah, part of neural crystals also might come over here for the pharyngeal arches. Now explain about the development of skeletal muscles. Okay, now muscles will come from mesoderm, but the point over here is it is not only mesoderm. We have different parts of mesoderm. We have different parts of mesoderm. Okay, like for example, in a brief or a generalized view, I'm telling you beforehand that we had a three mesoderms. If you remember, we had a paraxial mesoderm. Okay, then we had a second was intermediate, and third was, if I remember correctly, lateral plate mesoderm. Yes or no? This paraxial mesoderm over here, this gave rise to somites, and these gave rise to myotomes, and they formed the majority of the muscles. Intermediate mesoderm basically gave rise to the kidneys and the gonads. So kidneys and gonads, that is right. But little bit mesoderm again will give rise to some muscle structures. Basically, was it is giving rise to coelomic cavity. So some part of the heart muscle might come from here. That we'll see. Okay. Now let us just read some of the skeletal muscles, and there will be a few other things that will come into play once we go through this. So skeletal muscle of the exoskeleton, that is the central part, body or limbs and head develop from somites. So I told you now that somites, myotome give its distribution is too much the entire body. So you can see the exoskeleton, the limbs and all, they come from somites, paraxial mesoderm. So basically it's the paraxial mesoderm that is forming majority of the muscles, as I already quoted over here. Then each somite is differentiated into two zones, sclerotome, dermatome, fine. We have myotome, fine. We're not going to discuss this in detail because that we already have done. Here are a few things that can come as a one-liner question. Okay, myotomes of the eyeball, they come from muscles of the eyeball, they come from the periotic myotomes, and tongue, they come from the these. See, what is the point over here in discussing the muscles of the eyeball and the tongue? Let me highlight it here itself for you to appreciate. If you look at our head and neck, there are various muscles, like we have facial muscles. Okay, a lot of facial muscles are there. Then we have this eyeball muscle, where we move the eye. We have tongue muscles. We have muscles of larynx, pharynx, and all those muscles. Yeah, a lot of muscles. No, once you swallow any food, a lot of pharynx muscles are coming to play. I am speaking continuously, my larynx muscles are coming to play. So there are a lot of muscles in head and neck. Out of all of these muscles, out of all of these muscles, it is the somites. The somites are only giving rise to the eyeball and the tongue muscles. The rest of the muscles are not coming from somites, they are coming from neural crest cells. The facial muscles, the masticatory muscles, the laryngeal, pharyngeal, they are coming from neural crest cells, not from the myotomes. Myotomes are giving rise to only the muscles of eyeball and tongue. So, sir, what is the implication? This is a fact that you are telling us. What is the implication of it? Yes, it has an implication. What is that? That is Once you go into details of the neuro part, there is a group known as general somatic efferent for the head and neck. In the general somatic efferent, the nerve supplying the eyeball and tongue, only they will come. While it's neural crystals for them, we have a general visceral, not general visceral, but spatial visceral efferent. It's right over here. So just remember this. It will come again when we will discuss the neuroanatomy. Spatial visceral efferent is for the all the other muscles, and general somatic efferent is for the eyeball and tongue muscles. Remember this. This is one extra, or we can say I'm giving you knowledge ahead, a bit ahead, but I'm not going to details. It will come automatically later on once you will reach the neuro part. So you reach the neuro part, it will come on. So let us discuss muscles a bit more, and let me tell you the highlights of it. Okay, main parts of it. Yes, come over here into this part. Muscles, yes, this is the thing. Again, very important for your MCQs particularly is this two statement over here. What are these two statements? That muscles of the body wall, no? The entire trunk and all. This in trunk region is basically, yes, the derives from trunk region, that is thorax and abdomen region. They are also muscles over here. Interesting, very interesting. Each myotome divides into two parts, a small dorsal part, epimere, and a large ventral part, hypomere. So what does it mean? It means, see, if I'm bending forward, I'm using my abdominal muscles, correct? If I'm tilting to left, right, like tilting here and twisting here and there, I am voluntarily using my muscles of the trunk region. Here the hypomere muscles are used, which are supplied by the ventral part of the spinal nerve. If you look at the entire upper and lower limb muscles also, you might have heard of things like brachial plexus. Have you heard of it? Or lumbar plexus. If you look at all of these plexuses, they are coming from what? Ventral rami or ventral part of the spinal nerve. Now, this is the whole group of muscles, but there is a small group of muscles which are doing what? Which are helping in your maintenance of posture. Suppose you stand still for 5-10 minutes. Which muscle is being contracted? Obviously, your leg muscles are contracted, but in your trunk, it is the muscles around the vertebrae posteriorly, the small extensor group of muscles. Those posture maintaining muscles are basically commonly known as erector spinae group of muscles. And these are the only voluntary group of muscles. I repeat myself. These are the only voluntary group of muscles from myotomes which are not supplied by ventral rami, but they are supplied by dorsal rami. And that is the question QQQ that has been asked, and it will be asking you again. So remember that. How to remember it, guys? See, E for epimere, E for extensor muscles. Extensor means behind, and E for erector spine. So remember EE supplied by D. So E and D are very near, no, in alphabet. Okay. Here also it is written muscles derived from epimere. It is not that highlighted, but let me highlight dorsal ramus and muscles from hypomere. All these are supplied by ventral ramus. Remember this. And these are trunk muscles which are being shown over here. Muscles of head neck development, again we'll discuss them more in head neck, but as I already told you that it is the somites which is giving rise to which muscles in head and neck? Only two group. One is extraocular muscles, other is the tongue muscles. Simple as that, guys. And let me give you a quick fact over here. The fast twitching, the fast fibers of the muscle, the fastest fibers are found or the fastest, not the fastest, but the what you can say, the smallest motor unit are the extraocular muscles, because you can simply move them very fast, very minute movement, few degrees movement can occur in the extraocular muscles, right? That is also a high motor unit is present over here. High motor unit means that less nerve and more of motor unit being supplied from it. Muscles of tongue and that muscle pharyngeal arches we have seen. Okay, they're coming mainly from the neural crest cells, pharyngeal arches. External muscles of limbs. See, limbs again will do not that important. I'll give it one star over here. Just go through it. Basically, the limbs muscle are coming from paraxial or little bit mesoderm. They're coming from paraxial somites. At least remember that. And then just go through it, anterior-posterior condensation. You understand. Let us do some MCQs over here. Dermomyotome refers to dermatome and myotome. So both A and B fine. Bones of the axial skeleton is formed from. It is come from sclerotome. That was coming from the paraxial mesoderm. And if I over here ask you that, okay, bones of the appendicular, next question is bones of the appendicular skeleton are coming from, answer will be lateral plate mesoderm. Humerus, radius, ulna, hand bones, lower limb bones, femur, tibia, fibula, all that. Okay, pronator muscle of the upper limb from that condensation, no, you'll understand, not that complicated. Now let's do the last part of the day session. See, we are going, it's becoming easy, no? Correlated with the adult human body, things will be fine. So oral cavity, what are the different parts of oral cavity? And fine, oral cavity, see. And the interesting part of general embryology, if I correlate over here. Now listen to me very carefully, or let me use this empty slide over here for you to understand. We said, okay, there are three layers: ectoderm, mesoderm, and endoderm. Okay, ectoderm lies most outside, then there is mesoderm, then there is endoderm. Fine. Then we said, okay, no, but there are three concentric layers. How many layers are there? Three concentric layers. Fair enough. So outside there is ectoderm, then there is meso, and then there is endoderm. So if we say we label it as ecto, this as endo, and between it has meso. Okay. So between ecto and endoderm, now listen to my question very carefully. If you are going from ecto to endoderm, what you will always encounter, always mesoderm lies in between. So mesoderm, you'll always see that it lies in between ecto and endoderm. Fair enough. Till now, things are in control. Good. Now go back to general embryology, and we said in the beginning, in week, which week? Week 2, that there is an epiblast and there is a hypoblast. Agreed? Epiblast and hypoblast. But then I said, I gave you an example of my hand, that you place a glue over here and a glue over there. This glue in the cranial part will give rise to buccopharyngeal membrane. Glue in the caudal part gives rise to cloaca. You can go to my previous session, you will see over there. At these two places, what happens is, the epiblast and hypoblast, they fuse. Epiblast and hypoblast, they fuse. So what happens at these two places? For example, let me write the buccopharyngeal membrane and the cloaca. The epiblast and hypoblast, they fuse so that the ectoderm is in continuation to endoderm. Meaning by that, at these two, particularly these two places, there is no intervening mesoderm. So mesoderm is, now there's can be another question which has been asked. I'm not framing question from my brain only. It has been asked. So there will be a question that mesoderm is found at all of the places except where you don't find mesoderm. One is this answer, these two places. Other place, third place, you guys can answer. That we also have done. Mesoderm was present everywhere except axis, where we had the notochord, axial mesoderm. So mesoderm is present in these two places. Now, how to correlate it with the adult anatomy? And why I'm telling you over here? Because of this buccopharyngeal membrane which came into my discussion. Because we are discussing the development of oral cavity. No? Now see our oral, our mouth over here. This is all ectoderm, right? In fact, the gums over here, gums and the hard palate, that is all coming from ectoderm. Suppose you go to the tongue part. Tongue was coming from endoderm. Remember, the tongue comes from the middle part of the pharyngeal arches. The inside of pharyngeal arches is endoderm. So if you look at the gums or the palate and the tongue, one is ecto, one is endo. Is there anywhere mesoderm in between? Answer is no. So this is your oral cavity is a very good example. Oral cavity is a very good example to understand how the ectoderm is in continuity to endoderm. Similarly, if we look at the adult anatomy of the anal canal, again the same thing. The outer part of the anal canal is the ectoderm, and inside there is the rectum part and the upper part of anal canal, that is endoderm. Again, there is no intervening mesoderm. I hope things are making a bit interest over here, because these things you normally see in adult. Now, what is the clinical implication? Clinical implication, guys, is this, that there are cases I'm saying there are as if there are very, very few. No, there are. It is very common. It is a common disease that you may encounter in which department. Go to the obstetrics where there is happening this where the childbirth are happening and the pediatric department. When a child is born, the pediatrician is obviously called, be it a normal or a cesarean delivery, and the pediatrician checks all the Abgar score and all the stuff, basic stuff, and the pediatrician also checks the anal canal of the newborn child, if that is patent or not. Sometimes anal canal, if you look at the anal canal of a newborn child, it is closed. That is known as imperforate anus. The disease is known as what? Imperforate anus. That actually we have also seen in our gynae posting. We had that 4-day, 4-night posting in third year of MBBS. I hope that is also going on right now. Matty posting, you to call it as maternity posting, right? We have seen imperforate, we have seen one case of imperforate anus. What actually happens is that normally ecto and endo, when they are fused in cloaca, that fused membrane has to rupture. If that does not rupture, no, that becomes imperforate anus. So if you are seeing a disease, if you don't know how this disease actually occurred, then you will be, because you don't know what is inside this. Only if you have this knowledge, okay, that imperforate anus is that membrane. Suppose I try to make over here, outside black color is ectoderm, and inside this is all endoderm. Endoderm is developed over here. Only this part membrane, it has to normally rupture in development, and it failed to rupture. Simple as that. That is imperforate anus. Either you can wait for some time, normally it can happen, or else you have to perforate it and do it surgically. You have to make an opening, because else, obviously, whatever the stuff the child is having or in the intestine has to clean, normal thing, that won't happen. Okay. So now coming back to development of oral cavity, I hope you got the point why I placed this content in between. The reason was for you to understand that the areas in the body where we don't have an intervening mesoderm. Why? Because that will come automatically. That primitive oral cavity develops from ectoderm, as you can see over here. It is definitive oral cavity. And can you see? Can you see? In the first line itself, things are clear. There's ecto and endo. If you look at anywhere in the body, after skin, or not after skin, even in epidermis, below epidermis, there is dermis, mesoderm. Everywhere you have ectoderm, mesoderm, epidermis, dermis. What the point? Except these 2-3 places which I took. Very beautifully crafted MCQs can come from here. Two parts separated from each the buccal membrane, as we discussed. And here's a diagram showing you the same primitive node, primitive history, cloacal membrane. Okay. You can see these two areas are over here, which we are discussing. Okay, oral cavity comes from this stomodium, which is a part of ectoderm. So you can just go through them, ectoderm and endoderm, and things are very easy. Now just go through them, which part is coming from where. Tongue we already have seen coming from where. These are the sulcus. That is, I can just go through it. It's not that important. Also, let me tell you, I can give it 1 star over here. Finally, we'll discuss the beginning of the salivary gland over here. It will give you initial part of salivary gland. That is enough. The salivary gland produces saliva, right? How many major salivary glands are there? So in the beginning, they are giving like solid outgrowth of that is histology. Salivary glands are basically outgrowth of the epithelial lining. Okay, outgrowth epithelial lining. These are salivary glands. Salivary gland have two, or any gland per se in that matter will have two things. One is the cells which are secretory, which are secreting whatever secretion is coming from. And then after cell, there has to be a duct so that it carries the secretion, symbol as that. So what actually happens in development is, suppose this is an epithelium. There's an ingrowth in the epithelium like this, and then that ingrowth goes down and it will form few cells or whatever it is, and then it comes out. And in this few cells, what actually happens is this part becomes secretory. It will secrete. And then after this part becomes secretory, this part is the carrying part. It becomes a duct. So this becomes the duct of the gland, and this becomes the acini of the gland, and they're opening over here onto the surface. As simple. This is the basic core anatomy of any gland. Forget about salivary. Of any exocrine, not endocrine, exocrine gland. This is it. So now, how many salivary glands are there? Major. 3 major salivary glands are there. But there's a small addition to it. Few years back, it has been added to the list of tubarial salivary gland. There's also one more salivary gland known as tubarial salivary gland. So there are now 4 major salivary glands. We have parotid, a submandibular, sublingual, and tubarial salivary gland. It is near to the opening of eustachian tube. Now there's embryologically there's a basic difference. Parotid gland is mainly said to be coming from ectodermal part. Submandibular, sublingual, tubarial, they are said to be considered to be coming from the endodermal part. Basically, understand this part. This comes basically as an MCQ over here. Okay, let me highlight it. Parotid gland, ectodermal outgrowth, submandibular, endodermal, sublingual, endodermal. This is a basic difference. Okay, explain about parotid gland. Parotid gland explanation, guys, is more in the gross anatomy part. That is needless to discuss over here. The sublingual and the salivary glands over here. Yes, few basic by the timelines that we can study is that the submandibular gland develops at 6th week. Okay, sublingual gland develops at, even I don't remember the exact because it might 7th or 8th week, and two parts of oral cavity separated by, that we already have seen, with epiblast and hypoblast fused, that is buccopharyngeal membrane. Okay. Okay, guys. So now coming to the mid-gut rotation and all that intestine part that we'll do in the next session. Okay, so majority part again, it's not that difficult. So I gave you a homework. If you remember, what was homework? Foramen cecum, there's a duct coming down. We'll be looking for your answer in the comment box if possible. And second thing, before the next session, be prepared to come with the have some idea of mid-gut rotation also, because that will help you in easy understanding, right? That's all from my side, guys. I hope you enjoyed it. If any problem, any issue, do write in the comment box. Do reach out to us. Very happy. We'll be very happy to sort it out if we can. That's all, guys. Bye bye. Good night.